Bula Vinaka and welcome to Bula Wellness. I'm Dr. Alicia Sahukan, the Head of Health Protection with the Ministry of Health and Medical Services. In today's episode, we will talk about the meningococcal C outbreak, which is, of course, better known as Men-C. This outbreak was declared in March 2018 and over by December. But by the end of the outbreak, over 80 people had been infected and 6 had died. This is the second of a 2-episode story where we are focusing on the Men-C immunization program. But first we go to the streets to see what you, the public, know about Men-C.
What do you know about meningococcal?
Meningococcal, there was an outbreak last year, was it? That many of the people had sickness from it.
Very deadly disease. It's caused by Men-C.
It's a serious disease caused by bacteria.
What are some symptoms of meningococcal?
Some symptoms are rashes and fever that people get.
Your hands will be all like red, rashes will be applied. Yeah, you'll feel very lazy.
Vomiting, sweating, that's it.
What are some things you can do to prevent contracting meningococcal?
From contracting people from it is just don't share things like coughs because it spreads through our saliva. Yeah, that's all.
Just immunize yourself, like injection.
To prevent it, like don't share grog below and taki below. I mean to say like taki glass, and that's all.
Welcome back to Bula Wellness. This evening we have Dr. Torika Tamani, Head of Family Health at the Ministry of Health and Medical Services, and we are talking about the meningococcal C vaccination campaign. Welcome, Dr. Tamani.
Thank you.
So first of all, Dr. Torika, if you could just tell us about the work that you do in the Ministry of Health.
Thank you, Dr. Aisha. As has been highlighted by Dr. Aisha, I'm the Head of Family Health at the Ministry of Health and Medical Services. So under the Family Health program, we look after five, almost 6 different programs. This is child health services, maternal and reproductive health services, HIV and STI, adolescent health services, and the expanded program on immunization. So the expanded program on immunization program area was specifically tasked for the meningococcal vaccination campaign.
And of course, the expanded program on immunization is the routine vaccination program that we have for our children in Fiji.
Yes.
So what happened with meningococcal C? What is meningococcal C for one thing?
Thank you, Vinuai. The meningococcal infection is basically a bacterial infection. So as we all know, there are different organisms that causes infection. It can be fungus, like the skin infections that we have on our skin. Can be a viral infection, like the flu or HIV. And then we have the different bacterial infection, like pneumonia. So meningococcal infection is a bacterial infection caused by a specific bacteria called Neisseria meningitidis. So this particular organism is very
it's a very serious.
When it causes infection, it's very serious and almost very fatalistic. Yeah. So the 2 very big disease that it causes is meningococcal septicemia, that is in simple terms blood poisoning, and also causes infection in the brain, which is called
meningitis.
Meningitis.
Yeah. And before 2018, 2016, meningococcal was not a big issue in Fiji, is that correct?
It wasn't a big issue, but it was there at very low numbers. On average, probably 2 or 3 in a year.
Yes.
Earlier than 2016.
Yeah. So before 2016, we had between 0 to 10 cases a year. By the time the outbreak was declared, March 2018, of course, we had just under 20 cases. So we had a very big increase in the number of cases, of course. And because we worked together on the outbreak, we're very familiar with what happened there. But the Ministry of Health had a targeted program towards dealing with this outbreak. Part of it, and a very important part of it, was the meningococcal C campaign, and which you, of course, were in charge of getting into motion and making sure that it was implemented correctly. That's correct.
That's correct, Dr. Aisha. The Ministry of Health had formulated four specific strategies to tackle the outbreak. The first and foremost was to make sure that the clinical management was in place, having the clinical management guideline put together very quickly and made available to the officers who would be treating cases. And secondly, increasing our surveillance, as you are aware of. Surveillance was very important, otherwise we would not be picking cases early and finding out whether it was a genuine meningococcal C infection or not. And thirdly was increasing public health communication and just letting everybody know about the disease, and also about the fourth phase, which was the vaccination campaign. So basically the vaccination was the fourth phase of our response to the outbreak.
And the vaccination campaign, of course, is what your division was very much in charge of. We'll talk a lot more about the vaccination campaign after this quick break. Welcome back to Bula Wellness. In studio, we have Dr. Thorika Tamani, the Head of Family Health at the Ministry of Health and Medical Services, and we are talking about the meningococcal vaccination campaign. Dr. Tamani, before the break, we talked a little bit about how the meningococcal C vaccination campaign was one of a number of strategies for the Ministry of Health to control the outbreak. Could you tell us how the decision was made to actually start the vaccination campaign? What was the process in getting the vaccines, and who was our target population?
Thank you, Dr. Aisha. Yes, so the vaccination campaign was the fourth phase of our response to the outbreak. And the decision to conduct the vaccination was made by our Vaccine Preventable Disease Committee. This is a very important committee that decides on whether vaccination should be done if we have an outbreak, or whether a new vaccine should be introduced or not. So it was a decision made by this committee, and this committee is, the members are the senior management of family health, health protection, our medical clinical services network, pediatric services network, and also our technical partners like WHO and UNICEF. So that was the decision made by this august body, and from then there onwards we had the ball rolling into trying to get the vaccines. Now we must understand that the meningococcal vaccine is not our routine vaccine. It was something that needs to be approved initially for use in Fiji, and then also logistics would have to be sorted as to how to get the vaccines across. Now, because this is a very special vaccine and not easily available, there was negotiation by our counterparts in WHO and UNICEF to procure it from the UNICEF supply division. But for us to be able to access that vaccine, we have to go through a special committee called the International Coordination Group for Meningococcal Vaccination. And a submission was made to this special committee that is based in Geneva for approval to conduct vaccination, and also to seek the permission to access the supplies that was stored at the UNICEF supply division. So it was a two process: first to get the approval to conduct the vaccination, and also to access the stores.
And of course, the approval to do the vaccination campaign was not just within Ministry of Health. We had the National Task Force, which recommended the vaccination, and then of course the Vaccine Preventable Disease Committee, and then it went through a permanent secretary and Ministry of Health, the Minister of Health, and then there's a cabinet decision that was made to go ahead with the campaign and release the funds. So there was a lot of money involved, of course.
That's correct, Dr. Aisha. What was very important. The cabinet decision needed to be made. So the Ministry of Health made the submission to cabinet, and we are indeed very, very grateful for the swift response of cabinet in approving the vaccination, because of the amount of money that would be channeled towards the campaign.
Yes, and of course there was $10 million that was allocated towards the vaccination campaign. Part of this was supported by our development partners, the New Zealand government and the Australian government. In terms of procurement, as you mentioned, the supplies were approved by the ICG in Geneva, and then the vaccination itself came from...
Yes, Vanui, once we got the approval from the international coordinating group on meningococcal vaccination, then we worked with our technical counterpart, UNICEF, in procuring the vaccines. So because the numbers that we were targeting for vaccination was from all children aged 1 year to 19 years, and that amounts to about 310,000, more than 309,000, almost 310,000. So that was a big number of vaccines to procure within a very short period of time. So the assistance of UNICEF in facilitating our access to the UNICEF Supply Division in Copenhagen was very useful, and ideally we couldn't have done without them.
Yes.
In accessing that large amount of vaccine within a very short period of time. Apart from getting the vaccines, the other struggle we had, or the other challenge, was to store this large amount of vaccines in the country. So basically what was done in collaboration with UNICEF was to stagger the supply of the vaccines. So the supplies of the vaccine came in about almost 10 shipments. So as soon as the shipment came, the vaccines were cleared and stored at our Fiji Pharmaceutical Services stores, the National Storage Center. And our strategy for the vaccination was to be conducting the vaccination first in schools. As we all know, the number of children would be higher in schools compared to the community. So that was one of the strategies. As soon as the vaccines came, we had to distribute to all the medical subdivisions. And even within the medical subdivisions, we did advise them that you start the vaccination as soon as possible in the schools. Of course, we had already obtained the permission and approval, the relevant approvals from the schools to conduct the vaccination there. So that was one of the strategies to quickly decrease the load from our national storage to the subdivisional storage and right to operational level.
And of course, this was treated with a lot of urgency because it was seen as a protective mechanism to have the vaccine here to protect our children from this outbreak. That's correct?
That's correct. And there was, because of our public health communication, increased communication about the disease, there was a lot of awareness and a lot of waiting for the vaccines. So it really helped increasing the communications on the disease, and also increased the uptake, especially when we went to schools.
Yes.
So there was a quicker response to getting the vaccination done, even within the schools and also in the communities.
So the outbreak was declared March 20th, 2018. By early May, we had the first big batches of vaccines in and targeting the Central Division, of course. That was the most affected division. We'll talk a lot more about the logistics and the massive campaign that happened to distribute the vaccine right after this break. Welcome back to Bula Wellness. In studio we have Dr. Thorika Thamani, Head of Family Health at the Ministry of Health and Medical Services, and we're talking about the meningococcal C vaccination campaign. Dr. Thorika, before the break we talked a little bit about how you actually distributed the vaccine. Of course, the target population was pretty much a third of our entire population, everyone from the age of 1 to 19. So could you please tell us a little bit more about how you managed to try and cover all of these children?
Thank you, Dr. Aisha. like you said, 310,000 to be vaccinated within a very short period of time was a challenge. But I'm very grateful with the knowledge and expertise of our own Ministry of Health staff. If you remember, earlier in September 2017, we had just completed measles and rubella vaccination campaign. This was a national campaign, and we had learned from that national MR campaign in organizing a very quick micro planning and how we're going to distribute the vaccines and how the vaccination was actually going to happen at the with the communities. So that was a bonus for us. We had just finished the MR campaign, which helped even our supervisors in the fields to plan for the meningococcal vaccination campaign. So in terms of the vaccination campaign, we had to first conduct training for the supervisors. Going through the importance of having the vaccination done to address the disease in question, and also the logistics of distributing the vaccines and making sure that the cold chain requirements was adhered to.
So when you say cold chain, it has to be kept at a certain temperature. You cannot just have a vaccine out in room temperature.
Definitely. So this cold chain mechanism has to be maintained right from Copenhagen, even through the airways to Nandi Airport, from Nandi Airport to our storage at FPBS, and right through to the subdivision, and from the subdivision to the various field areas that the teams visited. That was paramount, that we looked after the potency of the vaccines, otherwise it'll be useless.
And just to give an idea, I think we've seen during the campaign, a lot of media coverage showing our nurses, who, biggest credit to them, going to the furthest corners of Fiji with these coolers with the vaccine inside, just to make sure that you're maintaining that cold chain, that the vaccine is kept at a certain temperature and taken to these very remote parts of Fiji just to make sure that the children are receiving the vaccine. That's right.
That's very true. That's very true, Dr. Aisha. Not only the nurses, we also had invited and engaged our officers from the Fiji military forces, and I'm truly grateful to the commander for releasing them. We specifically asked for drivers, and we were given drivers. And I must say, after the campaign, that there was no reports of any accidents or mishaps whatsoever. And the military drivers that were engaged also assisted with the logistics of carrying the cool boxes wherever the teams needed to go to. So it was the drivers, the nurses, and other people who assisted in carrying the vaccines, making sure the vaccines were safe, and also helping with the vaccination.
So our target population was just over 300,000, everyone from the age of 1 to 19. By the end of the campaign, of course it started in early May, it ended officially in October, the actual push out of the vaccine. By the end of the campaign, how many children had you covered?
By the end of campaign, 31st of October, we had vaccinated more than 280,000 children. So that was a big achievement for us within a short period of time to have vaccinated that number. So overall, we were sitting at 91% coverage of our target population.
And of course, we were really targeting 100% as usual within the Ministry of Health, but realistically, and to know that for the campaign to be effective, we were thinking around in the 80s, over 80%. Yeah. Something important to note is that other countries who have conducted similar campaigns, Australia in the early 2000s, reached just below 80% for their campaign. So we did actually very well, and it's a big credit to everybody on the ground who conducted the campaign. What's happening now? Is the vaccine still available? Can parents still vaccinate their children?
Thank you. Yes, the vaccine is still available, and as we speak, they are being distributed to the subdivisional health sisters. And the instruction is for the vaccinations or the vaccines to be made available at at the clinic, so whoever needs to be vaccinated can access the vaccines through the maternal child health clinics, because this is where the normal vaccination takes place. So apart from that, the vaccine is also being offered to our health staff.
Of course. And then, of course, the outbreak was declared over officially in December 2018. Why should parents still vaccinate their children?
It's very important that we are protected. With the vaccination, for any particular person who's getting the vaccination, you build up the immunity for 5 years. So you never know, even within the 5 years or this year, you may be exposed to the bacteria that may be here locally or from people traveling from abroad. So the exposure or the risk of exposure is still there. So that's very important why we need to still vaccinate our children, especially when the vaccine is still available.
And of course, the campaign targeted 1 to 19-year-olds. So in that space of time, we're having babies who have grown up and are now 1 year old who can receive the vaccine.
Thank you for
yeah.
mentioning that. That's actually true. So the vaccine is now also offered to everybody reaching the age of 1 year who may have missed the vaccination last year.
And an important thing to note is that by the end of the meningococcal outbreak in December, we had 85 cases that were known to have been infected. Of those, 36 confirmed. There were 6 deaths, and 90%, over 90% of cases were in those aged below 19. So of course, we were very much targeting that population that's most susceptible. So I think it's very important to highlight that we need to keep vaccinating those that are reaching the age of 1. What about the rest of the population?
As has been communicated earlier, prevention is better than cure. So we must always advocate for prevention. That includes simple things like hand hygiene, sanitation, having a clean environment to live in. And also we ourselves have to be healthy and well. So if there's any disease, the body will be able to fight it easier. Also it's very important that if people are sick, they needed to be taken to the hospital very quickly, so clinical management can start.
Thank you, Dr. Thamani. Unfortunately, time has caught up with us again, and this brings us to the end of this episode of Bula Wellness. If you have queries about the show or the topic today, like or contact us on Facebook, Bula Wellness FBC TV, or write to us at bulawellness@fbc.com.fj. Please ensure that your children, if they're between the age of 1 to 19, have received the meningococcal C vaccine. Otherwise, please join us again at the same time next week for our next episode. Until then, good night.